Welcome to Visions Beyond. Don't forget to like, share, and subscribe, and leave a comment with suggestions for healthcare topics you'd like us to deep dive into. Today, we're diving deep into artificial intelligence in healthcare,
Right.
and we've got some really fascinating sources here. Articles from the Cleveland Clinic, Foresee Medical Los Angeles Pacific University,
Wow.
and even some research straight from the National Library of Medicine.
Sounds like we've got a lot to cover.
Yeah, it's going to be a fascinating deep dive. So one thing that really struck me
Okay.
is how AI is already being used in hospitals and clinics, sometimes in ways we might not even realize.
Oh, absolutely. The Cleveland Clinic article highlighted how AI-powered chatbots are now being used to answer patient questions,
Mhm.
which can be so helpful for simple inquiries,
Right.
and it really frees up staff to deal with the more complex issues.
Yeah, that makes a lot of sense.
Mhm.
And then what's even more impressive is how AI is being used to transcribe medical documents.
Right.
I mean, that's not only saving time, but it's
Yeah.
also got to improve accuracy.
For sure.
And it's not just administrative tasks either.
No.
The article also talked about AI analyzing X-rays, MRIs, and CT scans.
Yeah.
It just seems like a huge leap forward in diagnostics.
It is AI algorithms can process and analyze medical images much faster than humans can,
Right.
and they can often detect these really subtle patterns that might be missed by the human eye.
Oh, wow.
For instance, the Cleveland Clinic is using AI to analyze brain scans for stroke patients,
Okay.
which helps doctors make faster and more accurate diagnoses in those really critical situations.
This is all about speed in those cases.
It can be life-saving
Yeah.
when time is of the essence.
So it's not about replacing doctors.
Right.
It's about giving them a powerful new tool.
Exactly.
Yeah.
AI is augmenting human expertise, not replacing it. Doctors still need to interpret the AI's findings and
Yeah.
make treatment decisions based on their own knowledge and experience. It's a collaboration,
Right.
a partnership that leverages the strengths of both humans and machines.
And this collaboration is leading to some incredible advances in treating diseases like cancer.
Yes.
I was fascinated by how AI is being used to detect tumors, sometimes even before they're visible to the human eye.
That's right. AI can analyze medical images with such precision
Wow.
that it can help doctors identify and track even the smallest tumors. For example, AI algorithms are being used to analyze mammograms to detect breast cancer at its earliest stages,
Oh, wow.
which can significantly improve treatment outcomes.
Yeah, early detection is key.
Absolutely. AI is also being used to track lung nodules over time,
Okay.
which is a much more efficient and accurate way to monitor potential lung cancer growth than traditional methods.
It sounds like AI is taking personalized medicine to a whole new level.
It really is.
I know that's a big focus in healthcare right now, treating each patient as an individual.
It is. And AI is playing a key role in this shift towards personalized medicine. AI algorithms can analyze a patient's genetic data, medical history, lifestyle factors to develop personalized treatment plans that are tailored to their specific needs and risks.
Okay.
This means patients are more likely to receive the most effective treatment with fewer side effects, leading to better outcomes and a higher quality of life.
This is making me think about the implications for drug discovery.
Yeah.
If AI can personalize treatments, it must also be able to speed up the development of new drugs, right?
Absolutely. The process of developing new drugs is incredibly complex, time-consuming, and expensive.
Yeah.
AI is being used to analyze vast amounts of data to identify promising drug candidates and predict their effectiveness,
Yeah.
which can significantly accelerate the drug discovery process.
Yeah.
This means new treatments for diseases that currently have no cure could become available much faster.
That's incredible. That's really exciting.
It is.
But all this sounds incredibly promising, but I know there are always challenges with new technologies,
Of course.
especially in healthcare. What are some of the hurdles we need to overcome with AI?
That's a great question. One of the biggest challenges is ensuring data privacy and security.
Right.
AI algorithms rely on vast amounts of patient data, and it's crucial that this data is handled responsibly and ethically. We need to have strong safeguards in place to protect patient privacy and prevent data breaches.
Yeah, that's really important. And then there's also the issue of bias.
Yeah.
AI systems are trained on data.
Right.
And if that data is biased, the AI can perpetuate and even amplify those biases.
You're right. If the data used to train an AI algorithm is skewed towards a certain demographic, the algorithm might make inaccurate or unfair recommendations for patients from other
This
demographics.
is a problem.
We need to be very careful about this and make sure that AI is used to improve healthcare for everyone, not just a select few.
Yeah, for all of humanity.
Researchers are working on developing techniques to mitigate bias in AI algorithms,
Okay.
but it's an ongoing challenge that requires constant vigilance.
So while AI has incredible potential to transform healthcare,
Mhm.
we need to proceed with caution and make sure it's used ethically and responsibly.
Absolutely. The future of AI in healthcare is bright, but it's up to us to shape that future in a way that benefits all of humanity. We need to ensure that AI is used to promote equity, accessibility, and quality care for everyone.
That's a powerful message. We've covered a lot of ground already,
We have.
from how AI is being used in hospitals and clinics to its potential to revolutionize drug discovery. But what does the future hold for AI in healthcare?
That's a fascinating question, and one that we'll delve into further after a quick break. Stay tuned. We'll be right back. We're back and ready to explore the future of AI in healthcare. What really caught my eye in the research from the National Library of Medicine,
Oh, yeah.
the idea of wearable devices that can predict health events before they even happen.
That's an area with immense potential.
Yeah.
Imagine a smartwatch that could analyze your heart rhythm
Uh-huh.
and alert you to a potential heart attack before you even experience any symptoms.
That sounds amazing.
Or a sensor that could detect changes in your blood sugar levels
Okay.
and warn you of an impending diabetic episode. So it's all about being proactive.
It is. These devices could empower individuals to take control of their health
Right.
and seek medical attention before a serious health event occurs.
That sounds like something straight out of science fiction.
I know, right?
But it seems like we're getting closer to that reality every day.
Yeah.
The 4C Medical article also talked about AI-powered virtual health assistants
Oh, yeah.
that could monitor our health 24/7. What would that look like in practice?
Well, these virtual health assistants could take many forms.
Okay.
They could be apps on our smartphones, devices in our homes, or even integrated into wearable technology.
Okay.
They could collect data from our devices, analyze our medical history, and provide personalized health recommendations.
So it's like having a personal health coach available to you at all times.
Think of it that way. Yeah,
It would be like having a doctor in your pocket,
right.
always there to answer your questions and offer guidance.
Exactly. And these assistants could also play a crucial role in managing chronic diseases.
Oh, how so?
Well, they could monitor a patients' vital signs, remind them to take their medications, and even alert their doctors if there are any concerning changes in their condition.
So that would help a lot of people.
This could lead to more effective disease management and potentially reduce the need for costly hospital visits.
All of this sounds incredible, but I'm also wondering about the human element in all of this.
Sure.
If we're relying more and more on AI to manage our health, what does that mean for the role of doctors and nurses?
Yeah, that's an important question.
Yeah.
And I think the answer is that AI will not replace healthcare professionals.
Okay.
Instead, AI will augment their capabilities and allow them to focus on what they do best,
Correct.
providing compassionate, personalized care. Doctors and nurses will still play a vital role in diagnosing and treating complex medical conditions.
Nice.
And AI will simply give them more tools and information to make better decisions.
So it's not about humans versus machines.
Yeah.
It's about humans and machines working together to create a better healthcare system.
Precisely, AI can handle tasks that require speed, precision, and data analysis,
Right.
while healthcare professionals can focus on the human aspects of care, empathy, communication, and critical thinking.
That makes sense.
It's a powerful partnership that has the potential to revolutionize the way we deliver and experience healthcare.
And this revolution isn't just limited to treating individuals.
No.
It's also transforming the way we approach public health.
Yeah.
I was particularly interested in how AI is being used to predict and prevent disease outbreaks.
That's a really exciting area of research. AI algorithms can analyze vast amounts of data from sources like social media,
Oh, wow.
search engine queries, and even weather patterns to identify potential disease outbreaks early on.
Oh.
This can allow public health officials to take proactive steps to contain the spread of disease and prevent widespread epidemics.
It's almost like having a crystal ball that can predict the future of disease outbreaks.
In a way, yes.
Huh.
By analyzing patterns in data,
Of-
AI can provide valuable insights into the spread of disease and help us prepare for potential outbreaks before they become major crises.
That's really powerful.
This is a powerful tool for protecting public health and saving lives.
The possibilities seem endless. But as with any powerful technology, we need to be aware of the potential risks and challenges associated with AI in healthcare.
Right.
We've already touched on data privacy and bias.
Right.
But what are some other concerns we should be thinking about?
Well, one concern is the potential for AI to exacerbate existing health disparities.
Okay.
If AI algorithms are trained on data that reflects existing inequalities in access to healthcare,
Right.
they could perpetuate those inequalities or even make them worse.
That's a problem.
For example, an algorithm designed to predict the risk of heart disease might be less accurate for certain racial or ethnic groups
I see.
if those groups are underrepresented in the training data. This could lead to disparities in access to preventative care and treatment.
So it's not enough to simply develop AI algorithms.
Right.
We also need to ensure that those algorithms are fair and equitable.
Exactly. We need to be mindful of the potential for bias in AI algorithms
Okay.
and take steps to mitigate that bias. This includes using diverse training data sets, carefully evaluating algorithms for fairness,
Uh-huh.
and involving stakeholders from diverse communities in the development and deployment of AI technologies.
It's a complex issue, but it's crucial that we address it head on if we want AI to truly benefit all of humanity.
Absolutely.
Another challenge I've been thinking about is the need for clear regulations and ethical guidelines for the use of AI in healthcare.
Absolutely. AI is a rapidly evolving field, and the regulatory landscape is still catching up.
Right.
We need to develop clear guidelines for the development, testing, and deployment of AI systems in healthcare
Okay.
to ensure that these systems are safe, effective, and used responsibly.
This is where collaboration between researchers, clinicians, policymakers, and technology companies becomes so important. We need to work together to create a regulatory framework that fosters innovation while protecting patient safety and privacy.
I completely agree. It's a challenging but essential task. We also need to ensure that healthcare professionals are adequately trained to use AI tools effectively and ethically.
Right.
This will require integrating AI education into medical school curricula
Okay.
and providing continuing education opportunities for practicing physicians and nurses.
It's fascinating to think about how AI will continue to shape the healthcare landscape in the years to come.
It is.
We've talked about wearable devices, virtual assistants, disease prediction, and so much more. But I'm curious to hear your thoughts on the bigger picture. What do you see as the ultimate goal of AI in healthcare?
I think the ultimate goal of AI in healthcare is to improve health outcomes for everyone.
Right.
This means using AI to prevent disease-diagnosed conditions more accurately, develop personalized treatments, and manage chronic illnesses more effectively.
Hmm.
It also means using AI to make healthcare more accessible, affordable, and equitable for all.
That's a vision I can get behind.
Yeah.
It's about using technology to empower individuals, improve public health, and create a healthcare system that truly serves the needs of all people.
Exactly. AI has the potential to revolutionize healthcare and make it more proactive, personalized, and precise.
Yeah.
But it's up to us to ensure that this revolution is guided by ethical principles and a commitment to improving the well-being of all.
Well said. This has been an incredibly thought-provoking discussion. I'm feeling both excited and optimistic about the future of AI in healthcare.
Me too. We're just scratching the surface of what's possible.
Yeah.
And I'm eager to see how AI continues to transform the healthcare landscape in the years to come.
Before we wrap up our deep dive into AI in healthcare, I'd like to remind our listeners to like, share, and subscribe to Visions Beyond. And be sure to leave a comment letting us know what other healthcare topics you'd like us to explore. We've talked about so many exciting possibilities. AI-powered virtual assistants, disease prediction, personalized medicine.
Yeah.
But what struck me in the Los Angeles Pacific University article was this idea of AI democratizing healthcare,
Right.
making it accessible to people in remote or underserved areas.
Absolutely.
Yeah.
That's one of the most promising aspects of AI in healthcare. Imagine a world where people in rural communities or developing countries could access specialized medical care
Yeah.
through telemedicine platforms powered by AI.
Wow.
These platforms could connect patients with doctors and specialists all around the world,
Okay.
regardless of location, providing them with expert medical advice and treatment recommendations.
Well, it would be like bringing the best medical minds to your doorstep, no
Right.
matter where you are in the world.
AI could bridge the gap between urban and rural healthcare, reduce disparities in access to care, and improve health outcomes for underserved populations.
And it's not just about connecting patients with doctors.
No.
AI-powered diagnostic tools could also be used in remote areas
Right.
where access to specialized medical equipment is limited.
Exactly.
That makes me think of those portable ultrasound devices
Yes.
that I've seen that use AI to interpret the images. That kind of technology could be a game changer for rural healthcare.
It could. Imagine a healthcare worker in a remote village using a portable ultrasound device to diagnose a pregnant woman,
Okay.
with AI assisting in the interpretation of the images. This could help detect potential complications early on
Wow.
and ensure that the woman receives the appropriate care.
It's incredible to think about how AI could empower healthcare workers in these settings,
It is.
extending their reach and improving the quality of care they can provide.
Absolutely.
But as we've discussed, there are also challenges we need to address as AI becomes more integrated into healthcare.
Yeah.
The National Library of Medicine research paper
Yeah.
talked about the need for transparency and explainability in AI algorithms.
Transparency is crucial. We need to understand how AI algorithms arrive at their conclusions,
Right.
especially when those conclusions have implications for patient care. If a doctor is relying on an AI system to make a diagnosis or recommend a treatment, they need to understand the logic behind the system's recommendations.
Yeah, that makes sense.
This helps build trust in the technology and ensures that AI is used responsibly.
So it's not about blindly following the machine's advice.
No, it's about using AI as a tool to inform human decision-making.
Right, it's a collaboration.
Exactly.
Right.
We need to strike a balance between harnessing the power of AI and maintaining human oversight in healthcare. And that brings us to the importance of ongoing research and development.
Yeah.
The field of AI is constantly evolving, and we need to continue investing in research to develop new AI tools, improve existing algorithms,
Yeah.
and address the ethical and societal implications of this powerful technology.
It's a reminder that AI is not a static solution,
No.
but an ongoing journey of discovery and innovation.
And that journey requires collaboration between researchers, clinicians, policymakers, and the public. We need to work together to ensure that AI is used to create a healthcare system that is more equitable, accessible, effective, and humane.
Well, this has been an incredible deep dive into the world of AI in healthcare.
It has.
We've explored its potential to revolutionize diagnostics, treatment, drug discovery, and even public health. We've also discussed the importance of addressing challenges like data privacy bias and the need for transparency and ethical guidelines.
It's been a fascinating conversation. AI is poised to transform healthcare in profound ways,
Yeah.
and I'm excited to see what the future holds for this rapidly evolving field.
So what does this all mean for you, the listener? AI is already changing the way healthcare is delivered,
It is.
and its impact will only grow in the years to come. As we move forward, it's crucial that we stay informed, engage in thoughtful discussions about the ethical implications of AI,
Yeah.
and advocate for a healthcare system that leverages this powerful technology to benefit all of humanity.
We encourage you to continue learning about AI in healthcare and to participate in the conversation about how we can shape its future.
Absolutely.
And don't forget that your voice matters. Share your thoughts, ideas, and concerns with your healthcare providers, policymakers, and community leaders.
Thank you for joining us on this deep dive into AI and healthcare. Remember to like, share, and subscribe to Visions Beyond. And be sure to leave a comment letting us know what other healthcare topics you'd like us to explore. Until next time, stay curious and stay informed.